Sacroiliac joint functional assessment. I'm going to go through a few different movements of the SIJ, both non-weight bearing and weight bearing. Standing forward flexion, thumbs on both PSISs. We're looking for a difference left and right. Get your patient to bend forward and touch their toes. We're just watching how the PSISs move in relation to each other and come back up. As we move on to the next test, which is Gillett's or Stork, we're seeing what happens at the SIJ with the non-weight bearing leg or the movement leg. So one thumb on sacrum, one thumb on PSIS, get them to lift up that same side leg and back down. And you want to watch as this thumb on the ilium drops down as it goes into a posterior rotation. And then the opposite side, so lifting up your left leg and back down. So this is our weight bearing side or our stance side. You want to see that as we load through our spine and through our weight bearing hip, our leg, that this SIJ stays nice and still and supported, that this thumb, the sacral thumb, doesn't drop down. So lifting up your right leg as my thumb drops down and then back down. And the opposite, so we're looking for a weight bearing leg, lift up your left and back down. And now functional squat testing, so double leg squat and single leg squat. So standing directly behind your patient, ask them to do a regular squat as far as they feel comfortable and coming back up. So you want to see that there's symmetry left and right, and go again for me. So on this one we can see, and coming back up, there's a drop on that right hand side. So we'll compare that with a single leg squat. So do left leg single leg squat please. And again, we're looking for a nice stable base, and then right side. So there we can see, and come back up, there we can see why on the double leg squat we were dropping out to that right. Active straight leg raise. You ask your patient to lift up their straight legs, lift your left leg up for me and down. We're seeing what happens through the trunk area, what kind of stability we have. Lift up your right side for me. And we can see here the amount of effort those trunk muscles are going to lift up that right leg. To tell whether we need to work on the posterior structures or the anterior structures, I'm going to compress the posterior pelvis. Lift your right leg again and back down. And I'm just looking at this trunk to see if our compensation is still there or not. And then I'm going to compress anteriorly. So I'm going to pull my hands and come in. Lift your right leg again and back down. Sacroiliac joint anterior to posterior joint mobilization. So you want to pop your hand underneath the SIJ, so fingertips on the sacrum, middle of your fingers on the PSIS, the space in between is the SIJ. That's your palpating hand. Hand on top, flat, find your ASIS. We're going to press straight down to an anterior posterior glide and then on an angle as if you were cutting a cake to find the biggest area of give. Then we're going to bias superiorly, back to the middle and inferiorly.